Hello, everyone. Over the past 2 years, community-based organizations and workforces have worked tirelessly to ensure their communities were kept informed, safe, and protected from the effects of the pandemic. From vaccines and boosters to education and outreach to integrating access to essential services like mental health support and food security relief, community-based organizations' unwavering efforts were crucial to both effective COVID-19 response and supporting communities' well-being. In today's webinar, presenters will reflect, highlight, and celebrate examples of equitable and effective COVID responses and share sustainability plans that promote the continued health and well-being of their communities moving forward. So welcome again, everyone, to our webinar today. What's next? Sustainability wins from community-based organizations' COVID-19 response. The CDC Foundation is so pleased to host this webinar in partnership with Vaccine Equity Cooperative and Health Leads. I'm Dr. Lisa Waddell, the Chief Medical Officer for the CDC Foundation, and will serve as your moderator today. Now, today's webinar is available in Spanish. To listen to this presentation in Spanish, click the globe icon at the bottom of your Zoom screen and select your language. This webinar has also closed captioning option. To enable closed captioning, please click on the closed captioning icon on the bottom of the Zoom screen. Now, before we begin our conversation today, there are a few additional housekeeping items we'd like to review. Today's webinar will be recorded and sent to everyone who registered, along with any materials shared. During today's webinar, we'll have time to answer many of your questions, so please submit your questions using the Zoom Q&A button found on the bottom of your screen. You can also use the Zoom chat feature to share comments, reactions, links with your fellow attendees and panelists. And then last but not least, we will be launching a poll, an evaluation survey at the end of the webinar, but also today we're going to have a couple of polls throughout the webinar, so we invite you to please participate in those. Now, during our conversation today, our goal again is to share as much information and guidance as we can on sustainability for COVID-19 response and beyond for other key public health issues. Our speakers will share what has worked for them in creating structures for the future, as well as how their courses have shifted during the pandemic. They will also be sharing policy wins that they've had in their communities. And they, again, will work to answer as many of your questions as they possibly can. I'm really thrilled. We have a really fantastic group of experts with us today. And you can find their bios in the links to their bios there in the chat. But we're going to have with us today Dr. Marilyn Watkins, who is the wizard, if you will, behind our capacity building team and assistance that the Foundation's been providing. She is our COVID-19 COAG CBO director here at the CDC Foundation. We have Venus Gines, who is the Chief Executive Officer and founder of Dia de la Mujer Latina. We have Khadijah Walker-Fobbs, who is the Chief Strategy Officer with the Judson Center. And we also have Jenna Nelson, who is the Department Director with Family Service of Rhode Island, and her colleague, Kenzel Thomas, who is the Vice President of Equity and Community Development with Family Service of Rhode Island. So without further ado, we're going to go ahead and get started. And to get us started, again, I'm going to turn the program over to Dr. Marilyn Watkins, who is the COVID-19 CBO COAG Director for the CDC Foundation. And she's going to share some highlights on what we've accomplished together with you all. Marilyn, to you.
Thank you so much, Dr. Watkins, Dr. Waddell. Good afternoon, everyone. I'm so excited to be here today as we discuss sustainability and what's next. You know, at the beginning of the COVID-19 pandemic, the CDC Foundation was actually funded by CDC to assist in the fight against COVID-19. And this project had two priorities. The first priority was to hire surge staff, and that was for immediate needs in the fight against COVID-19 in the states and in the territories, as well as other areas, the cities and tribal areas. The second priority was to provide key connections and support for community-based organizations that were fighting this pandemic at the ground level. And it's that priority that I am going to discuss today at this time. You see, we were tasked with ensuring that CBOs received the information that they needed to succeed in their efforts against COVID-19. And after a review of all the concerns that CBOs were having, we decided to focus on three target areas. And those three target areas were sustainability, communication, and partnership. So when looking at sustainability, we realized that funding a project does not necessarily equal success. And I'm sure you would agree with me that that is the case. So what could we do to increase the likelihood that CBOs would have the ability to maintain their programming and its benefits over time? This set in motion what we now call our capacity building assistance framework. And this framework allowed us to focus on CBOs because you are the respected leaders in your local community and you understand the needs and the concerns of the communities that you work with. You see, we recognize that CBOs are trusted and you can convey health information in a way that no one else can. Lastly, we noted that partnerships were essential if we were going to make a difference in this pandemic. So this desire to help CBOs to be successful, it led to quite a few initiatives. And we set out to do three things. We set out to develop CBO-specific resources. We set out to support partnerships, as well as enhancing the sustainability and the viability of your CBOs. But in order to do that, we decided to provide timely information to the CBOs, and we developed some national communication resources. So as you look on this slide, you will see that we have a newsletter that comes out monthly. It's a Stronger Together newsletter, and it highlights the latest COVID-19 information, but it provides it in a way in which you can be actionable. We also developed a national webinar series, and this webinar today is our 14th webinar. In collaboration with the Vaccine Equity Cooperative, as well as Health League, we have conducted webinars on COVID-19 and mental health. We've discussed misinformation. We've provided you with the latest information on vaccines, as well as pediatric vaccines. And we also talked about how to keep our children healthy at school. We've had town hall meetings, and we've gathered information on topics that were important to you. And we have introduced you to subject matter experts. In our webinars, we've had people from CDC, from HHS, from the White House, to include the Surgeon General, Dr. Murty, Dr. Michael Beach, Dr. John Smith, and we also introduced you to Dr. Webb from the White House, and so many more. We heard you when you said that you needed information on long COVID. So we produced a fact sheet just for you to tell what CBOs can do in the fight against long COVID. We've done impact stories, and we have a resource page on our website. And all of this was done in order to provide you with the information that you let us know that you needed. Next slide. So as we look at some of the achievements, we see that we have actually had over 11,000 people that have actually attended our webinars, with over 20,000 registering for these events. That was what you did. Our success was based on you. Next slide. We also have reached over 9,000 people on a monthly basis with our newsletter. We provided tailored capacity building services to 133 unique CBOs, with some of them requesting support even after that. So we've had 177 total instances of capacity building. We've also had 173 partnerships that have been developed with community-based organizations and health departments. So today, we really want to let you know that our success has been your success. You have made us successful in our efforts. And today we want to say thank you. You have gone through the struggle and you have persevered. And that perseverance produced character, and that character produced hope. And because you had hope, you were able to do things that you didn't even think that you could do. You found a way to work in those communities. You found a way to partner with community organizations and with health departments. You formed those relationships. You conducted pop-up clinics and with barbershops and beauty salons. You worked late nights and early mornings. You did whatever it took to get the information to your beloved community. You know, there is an African proverb that says, when spider webs unite, they can tie up a line. And that's exactly what you did. You worked hard, and the fruits of your labor are very evident to the world. The world knows now that CBOs are the core of public health. You see, because you know where people are, you are with them in their community. You see where they live, where they work, and where they play. And so today, we celebrate you and we lift up your groups and we give you praise for all that you have done in the COVID-19 pandemic. You came, you saw, and you conquered. Thank you. Gracias. Yakosi. Merci. Thank you. So after reflecting on the impact that we've made together so far, we want to know how you would prefer to keep learning and sharing with us and for one another in the future. So we are now getting ready to launch a quick poll to survey your preferences and how you want to be contacted and keep in contact with us. So please take a moment to share your thoughts. And again, I say thank you.
Thank you so much, Dr. Watkins. As you all can see, we have the poll here waiting for you all to respond. We'll leave that up for just a few more seconds. And so your choices are, how would you like to stay connected? And you can check all that apply, continue to join existing webinars, meet in smaller peer groups for more shared learning, join Slack channel for latest peer updates and working groups, receive updates via an email and newsletter, follow Vaccine Equity Cooperative and CDC Foundation on social media channels, or other, and you can type in any other suggestions in the chat. Okay, I think we can put it down now and see what the results are, if the results will show. Okay, great. So as you all can see, these webinars are helpful and you would like to see them continue. So that's really great feedback, as well as the newsletters. And then there are those of you that are interested in other things as well. So thank you so much for that just-in-time feedback. Okay, so now we're going to move on to our next presenter. And again, we're going to hear from Venus Genis, the CEO and founder of Dia de la Mujer Latina. And so Venus, let me turn it over to you.
You are great. So thank you. You're not culturally competent. Hey, everyone. Buenas tardes. My name is Venus Genis, and I founded Dia de la Mujer Latina 25 years ago. So we are excited about celebrating not only 25 years of training promotoras and community health workers, but also 25 years of serving our Latinx community with early detection screening, not only for breast and cervical cancer, but also for diabetes, hypertension, HIV, and so many other chronic diseases. So we're excited. This has been an amazing year, but let's talk a little bit about what happened the last 2 years. So the next slide. So as you can see, we have a timeline of all the activities from the beginning of COVID. In February, on February 12th of 2020, way before the pandemic was called out, we had already developed our first bilingual training for promotoras and community health workers on dispelling myths about COVID. And we launched the webinar on March 5th. We had different trainings around the state of Texas on February 28th. By March 15th, we already had trained over 5,000 people about dispelling myths about COVID-19. So we continued to monitor what was going on. Once the pandemic was called, we immediately looked for ways to get to our community as quickly as possible. So we set up 10 hotlines by April. And as you can see on the slide, these cities, we have been partners for many years. So it was very easy for me to pick up the phone and say, let's do this. Also in April, we decided to put together a telehealth community navigation contact center where we wanted to reach the people and have a phone line for them to call, not only us, but some of the people around Texas that we also had partnered with, meaning like El Paso and the Valley and Brownsville and so many other areas in Texas. Then in June, we started realizing that there was a need for contact tracing, tracers, and we developed the training both in English and Spanish. We turned it over to CDC. We were right on top of it. And by the end of June, we were able to provide 273 promotoras and community health workers applications to the city of Houston and Harris County Public Health and so many other places. So they were immediately employed as contact tracers. And also in June, we started our Facebook Live to be able to talk to our community about what was going on. And we would have people from Baylor College of Medicine or Texas A&M or some of the people that we partner in the city of Houston and Harris County to come and speak to the community about vaccine hesitancy and how we can, work through some of those barriers. And also in June, we realized that the call center was getting a lot of calls with people that wanted to commit suicide, domestic violence issues, substance use. I mean, the list goes on and on. So we developed our behavioral health community navigator training. It was approved by the state of Texas, and we were able to launch that throughout Texas and to many of our partners around the country, including Puerto Rico. And this was a little bit part of the mental health first aid and psychological first aid, and then a little bit of everything else that we have put together as far as meeting the needs of our Latino community. Then in August, we realized that we needed to really work with our research community and develop what we call a clinical trial community navigator program, where promotoras and community health workers can be the ones that are not that are available to answer questions, recruit people into some of these clinical trials, which is so important. And then in April of 2021, the governor of Texas gave us a proclamation for Community Health Worker Day. And we had a conference where we're talking a little bit about debunking misinformation, looking at the new role of telebehavioral health and how important that is to develop the protocol for vaccine confidence for our community health workers. And then in January, on Martin Luther King's birthday, we launched our vaccination community navigator training, where we had it in 4 modules, and I worked with Vaccinate Your Family for that project. And our program was slated in really getting our community health workers to be right on top of what is vaccines, what do they do, how important it is for our community to learn about vaccines for children, vaccines for our seniors. So this is a 4-module program that's available through Vaccinate Your Family and DML. And we continue to work with our Health Fiesta. And this year we launched our Prepare for COVID Aftershocks, where we pulled everything together of what was happening in our communities, how we were addressing it, and looking at mind, body, spirit, and how we can work with our community doing that. So we've launched the Health Equity Tour in 6 US cities. Next slide. So what we do is just that. Our promotoras and community health workers are trained to do these types of screening, early detection screening at their churches and their community settings in order for them to start the conversation. And next slide. So this is our what we call our milestones. This is what happened in the last 2 years. Over 500,000 health education materials were distributed. And I wanted to just preface here that we're very strict on what we distribute. It has to be culturally, linguistically appropriate for our community before we even think about distributing it to our community. We saw that there was a lot of infographics with featureless faces, and that is a symbol for domestic violence in our Latin American community. So we weren't going to be distributing that kind of information. And our clinical, our community health workers have been amazing. They've been trained on how to deal with some of this hesitancy, but also provide our community with evidence-based information to alleviate some of their fears and their mistrust. Next slide. So how do we do it? 4 words. We motivate our community to get early detection screening. We inform them in a way that is culturally and linguistically appropriate. We navigate them through the course of all their care and all their questions. So when they come to our event, we register them in such a way that when after the event, we call them to make sure that they were okay, did they get vaccinated, and what were the issues that they ran into when they were vaccinated. And then at the end, we gave them that opportunity to educate them and provide information for them. Next slide. And I can't say enough about our sponsors, beginning with Pfizer, who was with us from the very beginning. Our relationship with Pfizer is now 12 years, and they have really supported our Promotoras program, and they were there on call immediately to work with us on our setting up our 10 hotlines. And of course, you know, HRSA provided us with the behavioral health program where we were able to train more community health workers under HRSA, and then the other programs that you see here, including the CDC Foundation, that provided us some seed money for some of our programs as well. Next slide. So I just want to give you an idea of how our telehealth community navigation contact center works. This is just one day. Our calls when we launched when the White House was distributing all of the COVID kits, they provided the community with our call center number, and we were taking these calls. So we had over 1,300 calls within, I guess, about 2 hours. We were just inundated with calls. It was just amazing. But those folks that called, they became our family. And now we call them just to see how they're doing. And that's part of what our community health workers do. They do that follow-up call just to make sure that they're not lost in the system. Next slide. And so here we are. I want to take a moment to again say we would not be where we are had it not been for our promotoras and community health workers. They are, I would say, the most precious jewel that this country has, and we're not utilizing their skills, their ability, and their passion to bridge those gaps that we see, to break down some of those barriers that we have seen over the years. Our training program, we are an apprenticeship program now, and we train them to be telehealth community navigators. We train them to be behavioral health community navigators, patient navigators, clinical trial navigators. We're working now on a project to get more promotoras and community health workers in the school to avoid what happened in Uvalde and some of the other places where we are having a lot of issues with parents really worried about having their kids go to the schools lately. And then, of course, as you can see from here, you know, disaster, we're in Texas, so we're ready for a hurricane any minute. We have flooding. Our promotoras and community health workers are key in addressing some of those issues because of the mistrust. They are there not only informing the people of where to go, but navigating them through the process. And as I continue to look at what's going to be the future of another pandemic, we need to engage community health workers from the start, get community-based organizations to be there in the planning committee of any kind of strategic plan, because without our community-based organizations, we will miss the boat again. We will have the same issues over and over like we did in the last couple of years. And I know that I spoke really fast. I am Puerto Rican. I am sorry. And I know that the interpreter's probably going crazy, but what can I say? I hope that if I have to say anything in Spanish, I'll be happy to say anything in Spanish.
Thank you so much, Venus. That was great. I just wrote down so many pearls of wisdom that you shared, and I'm sure that others caught this as well. But one of the early things you made a point is that your community health workers, your promotores, were hired, and so we hear that so much about the importance of not just utilizing this level of expertise as volunteers, but making sure that they're appropriately compensated. So kudos for making sure that happened. You created a behavioral health navigator training, and I'm sure that could be an important resource. Your slide that had your sort of 10 steps, the timeline, I think is a really great resource from beginning to sort of end, if you will, or current, that can be really helpful to other organizations as they're thinking about sort of the path to do all of the things that you've done. Motivate, inform, navigate, and educate, such a key inspirational message there. And I could go on and on, but certainly as you ended, the importance of engaging community health workers from the beginning and community-based organizations. I also noted how you shared who some of your supporters were, if you will, or your sponsors. And when we get to the Q&A session, perhaps you can expound on that a little bit, because we know that from a sustainability perspective, that certainly is one of the things that's really important. And so maybe you can share a little bit more about how they engage with you and the kinds of things that were most helpful in getting that kind of support from some of your sponsors. So with that, thank you again so much for that presentation. And I'm now really pleased to introduce Khadijah Walker-Fobbs again, who again is the Chief Strategy Officer for the Judson Center. And so Khadijah, I'm going to turn it over to you.
Thank you so much, Dr. Waddell. I appreciate it. Thank you so much for having me. So we at Judson Center are very excited about the work that we've been able to do was part of this grant. Judson Center is based in Southeast Michigan, so we serve primarily the greater Detroit area, and this grant centered around the greater Detroit area and Detroit. And so what we were able to do was form two key partnerships that helped us administer the work in terms of how we assigned community outreach workers during the height of the pandemic to address the needs. You can just go to the next slide if you don't mind. And so we're going to talk just a little bit about the approach that we took, which I can just say this: relationships. It was all about building trust and relationships as part of this bigger coalition effort. We called ourselves the Detroit Equity Coalition on COVID-19, and our partners were Practice Transformation Institute and the development centers. And that part was key because Practice Transformation, or PTI, was able and was registered to be able to administer vaccines. So that was a really key partnership for us while we focused on building out the community relationships. Having that partner that could come in and do pop-ups to help promote access and do the education with trained medical professionals was one of our key strategies that we used as part of this work. And so what we did was that we really focused on joining community events in vulnerable neighborhoods and communities that were already happening, that were already established, coming alongside and being able to provide financial support, food items, all of these things, and literally build relationship. We had 3 community outreach workers, and their whole job was keeping those relationships strong, providing support, and showing up at every activity, whether it was a church cookout or a barbershop event or an Easter egg hunt. They were out there with a tent, with information, with resources, and just continuing to build on those relationships. Next slide, please. Here's just a snapshot of 129 partnerships that we were able to make part of this coalition through this grant work. We met every month. We would always provide a meal, bring everybody together. And one of the key strategies we also use is we would always have the coalition partners themselves share what we would call testimonials at these coalition meetings about the impact of the work and the importance of education and vaccine outreach. And that was one of the most effective tools we could use. We would literally have people come from community and neighborhood organizations and say to the group and say to partners, I myself was vaccine hesitant. I myself have family members who have no trust coming from certain communities in Detroit in the medical field. And there was a lot of misinformation. And then they would share their story. Sometimes we would record it and reuse it or just let them talk and answer questions. And that was part of the overall strategy, once again, of being able to bring people together, build trust in these communities, and continue to strengthen it. And so this is not all of our partnerships, but just a snapshot, because we were very strategic to make sure that we were reaching out to a very diverse array. We had participants coming from our Mexican consulate. We do regular community pop-ups every month with the Mexican consulate. We had partnerships coming from a lot of our African-American churches in Detroit, some of the mosques in our areas around Dearborn, which have a very high Arabic population. So that was really key also, being able to address the needs of this very diverse population coming from our metro area. Next slide. So just a couple key numbers. We were able to directly reach just in this short time over 10,650 people. And when we know we reached more, but those are the ones that we actually tangibly had sign on. We were able to talk to, we were able to provide educations. Our health team was able to answer questions and directly make that connection with the community. We were able to officially sign on 129 partners in the metro area as part of our overall coalition efforts. And we were able to directly vaccinate over 2,500 people. And I say directly because, like I said, one of our partners that we were fortunate to have on our team was able to administer those. And so pop-ups was always part of the strategy of every event. Even if it was just 10 people, there was going to be somebody there present to just make sure any area barriers to access were addressed or transportation was addressed. All right, next slide. So some of the lessons that we learned through this, and once again, I already said this, but we built relationships. And so being able to, once again, build on events that were already happening with communities that were already in the neighborhood, that already had that trust, already had their constituents, was really key. Many came to rely on us to kind of be the go-to to answer questions or call in for different things. We were very well trained about being non-judgmental with any staff that went in, making sure that we had appropriate strategies around language and culture, because Metro Detroit is extremely diverse. We used motivational interviewing strategies with people who were hesitant or had challenging questions. And so all of that, once again, really comes down and boils down to the relationship portion of this work with community organizations. Next slide. Here's just a couple snapshots because picture is worth 1,000 words. So you see the diverse array of events and outreach that we did. We have a fun picture at a Cinco de Mayo celebration, and just they were out in the community. We probably do on average about 15 community events a month that we are present at with tables, and that doesn't even include some of the smaller types of things that happen. Next slide, please. Now let's talk about sustainability, which I know is obviously the key focus. And so this was a tough one, and it took some time to kind of think about how do we maintain this great work and this great coalition that's centered around this grant long after our funds are dried up. And so one of the things we did is we took an approach where we built on the success that we had through the Detroit Equity Coalition on COVID-19, and we were able to apply for funding for a Regional Health Equity Council grant. This was through the Michigan Department of Health and Human Services and the Michigan Public Health Institute. And that grant was really key and was part of our long-term strategy because we were fortunate to be awarded that because of all the success we've had with DECC. And we were able to bring people through a council type method to help set us priorities and goals and talk about what this sustainability looks like long-term. And so the model that this council came up with, building on this work, was certified community health workers. So it was very exciting for me to hear our speaker, Venus Jeunesse, just share about the importance of community health workers, because that literally is our sustainability strategy. And so what we are doing is we are funding organizations who are in the community to send 1, 2, 3, 4 community health workers to get trained under the grant with our medical team, get certified, and we were even able to get some of the payers to pay for tablets that the community health workers can keep long after this grant ends. The tablets are a way to collect survey information and data, and be able to share that data around barriers and access issues that will stay with them long after we're gone. And the key piece of this is that these community health workers come from a wide array of community organizations that we're already partnering with. They're not going anywhere. Those organizations are here to stay, and those are their staff and their employees. And so that's our long-term sustainability strategy. We will start December 15th with the training. It's about 160 hours of training that our workers will go through. And we're really excited about this model and being able to make sure that we continue to build on the great work that's been done. Thank you.
Thank you so much, Khadijah. That's really exciting. And to reinforce a key message: relationships, 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 and building those relationships and going to the places where folks already are, and being seen and present in a consistent way so that those relationships are built. And monthly meetings and meals with those meetings is important. And testimonials, right? The power of stories, connecting the stories with the work. Clearly, equity centered approach is the way that you all are doing it. And, and quite frankly, just delivering key results. And with those results, then you subsequently get ongoing resources as well. And so I really like the notion how you pointed out here, this collaboration with the Michigan Department of Health and the Michigan Public Health Institute. And so far, everyone that's listening, the health departments across the country need you. And likely many of you are working with them. And so it's that collaboration, that partnership that we hope that you're able to continue. And then I heard this just yesterday in a different presentation also about this notion of training and certifying community health workers as a means for sustainability. Again, compensating folks for the work that they are doing, the impact. So great job. I hope you're seeing all those kudos in the chat feature pop up, and thank you again for your presentation. So now we're going to move on to our next presenters from Family Services of Rhode Island. Or do we have a poll question next? I think the poll question is after this. So we're going to move on to Jenna Nelson, again, who is the department director, and Kenzel Thomas, who's the vice president of equity and community development. And let's see. Yes. So I'm going to turn it over to you all.
Thank you, Dr. Waddell. We're excited to share out on some of the work we're doing in Rhode Island. Next slide, please. So first, we just want to say thank you certainly to the CDC Foundation for inviting us to share out on our work, and the CDC Foundation and Rhode Island Department of Health for funding some of what we'll talk about today, and countless community-based partners that have made this work possible. Next slide. So I will give a snapshot of the COVID response efforts that we've been working on since the pandemic started. These activities all came in at various points during COVID, and they are all ongoing in some fashion. And my colleague Kenzel will share how about some of the evolution of these efforts. But we have a COVID response certified community health worker who has been screening for social determinant of health needs, connecting residents to resources, educating on COVID safety, vaccination, testing, quarantine and isolation, and PPE distribution. We have a Collaborate to Vaccinate project ongoing currently, working with well-known and trusted community partners in a very geographically small but diverse community in Providence, Rhode Island, to host flu and COVID vaccination clinics. Be Safe, we have our Be Safe program, which was our really sort of the initial response of our agency to the COVID-19 pandemic. This really kicked off right away in March 2020 at shutdown. And this was a statewide project for emergency response to supplies that folks needed. And this program has distributed and delivered kits with PPE and 13 meals per kit of non-perishable food for those who have needed it. And this is just at resident request across the state that we are able to distribute and deliver these kits. And lastly, the South Providence Health Equity Zone, better known as HEZ, is a place-based health equity initiative working in the 02905 zip code in Providence, Rhode Island. So this is, again, it's a very small area. It's about half a square mile, but very diverse with lots of different needs. As an agency, we convene a collaborative as the backbone of stakeholders. Those are residents, businesses, lots of CBOs to define health inequities and develop place-based solutions. So having this ongoing at the same time as COVID, there's definitely been overlap with the other initiatives that I just mentioned. And again, my colleague Kinzel will talk a bit about that. But next slide. So here's just some data points for Be Safe. We have done, again, since March 2020, almost 20,000 deliveries and over 60,000 people served with Be Safe kits across the state of Rhode Island. That COVID response community health worker, again, we're talking about a very small area that in that initial span of time when we first got started, there were 140 social determinant of health screenings, and we responded appropriately based on the needs that were identified. And you can see there, food insecurity was certainly the highest, and that really drove the need for us to continue the Be Safe project and make sure we included food as part of that. Collaborate to Vaccinate, those flu and COVID vaccinations, that is a newer project that just started up in September. We've already had over 100 folks vaccinated in and around Providence, and 60 plus against COVID-19 since we started. And this is in an area where we were pretty stagnant for COVID vaccinations. We really weren't seeing the numbers go up at all for folks vaccinated. But as we started standing up clinics in places and with partners that the community trusted, we saw that they certainly were receptive to getting vaccinated, which has been fantastic. And for our South Providence Health Equity Zone, we're actively working with over 10 community partners now and 6 consistent resident voices within our collaborative. Again, this is that 02905 tiny little zip code. And we've also established HEZ Connects, which is a part of the Health Equity Zone. We have a community health worker stationed at various community organizations and places within the community where residents can just come up and get support with whatever it is that they might need. And certainly as COVID has changed over time, those needs have changed over time with it. But I will turn it over to my colleague Kinzel to take it from here.
Thank you, Jenna. I appreciate it. And good afternoon, everyone. Thank you for having me. So I'm gonna walk us through the next couple of slides and start off with the change in shape of response. And as Jenna mentioned, our connection in South Providence with the Health Equity Zone was one way that we were able to change the response to the community. We used the Health Equity Zone to engage community residents as well as grassroots organizations in South Providence, churches in South Providence, our schools, our health centers, and our community centers. One of the things that we're excited about that we were able to do is we were able to change the rate increase for community health workers, particularly during the time at the height of the pandemic. We also took a different approach on how we recruited community health workers. We knew that we needed to get folks that were a familiar face in the community. We wanted to get your neighbors. We wanted to get trusted community members. So we were intentional about targeting folks that lived in South Providence to lead this initiative. And we threw the job description out of the window in order to do so. We did not ask or weren't looking for folks who had relevant experience or a college degree. We wanted to bring in folks from the community. We wanted to train them to become community health workers, and we successfully were able to do that with the folks that we brought in, and they are still with our agency today as certified community health workers and leading the charge in South Providence. And this approach allowed us to engage community residents, provide them with the resources that they need, and now also we are a trusted face in the community to lead vaccination efforts. Some of the resources that we were able to also help folks out with was affordable housing and community access to behavioral health supports. During the height of COVID, our community health workers were able to identify folks in the community who were struggling with mental health, and we were able to connect them with appropriate resources. Food insecurities was another area that we were able to respond to, as my colleague mentioned, through the Be Safe program. And there were residents in our small community who used the Be Safe program multiple times a week to provide them and their families with food. Some public health strategies and programming that we have looked into is additional community-based public health events. So through the HES program, we are able to stand up health and wellness fairs. Again, this work is being led by community health workers that actually live in the community. So we're able to bring people out to these fairs, provide them with vaccinations, provide them with other materials and supports around social determinants of health needs. We have a strong connection to our schools and to our community centers, and we typically look to host these events at these sites where we know our folks in the community congregate so we can have maximum community participation. Next slide, please. So some of the branded funding for the work that we've been able to do here in Rhode Island certainly has happened through the Health Equity Zone that's funded through the Rhode Island Department of Health, health disparities funding through the Rhode Island Department of Health, certainly Collaborate to Vaccinate through the CDC Foundation, and resources through community businesses and distribution centers. And just to add to the last bullet point, the connection with our community businesses and distribution centers have allowed us to provide families, churches, community centers, schools with PPE supplies at the height of COVID. And having that connection was critical for not only our community, but it was critical for us as an agency because it allowed us to continue to be out in the community, knocking on doors, engaging with families face to face, because we had the PPE to do so, and certainly connecting with our local businesses and distribution centers were pivotal in us continuing to do our work at that time. Next slide, please. And so the road ahead, as COVID-specific resources wind down, focus on funding opportunities is shifting to equality and justice projects. COVID has left a number of inequities in our community, and our community health workers complete social determinants of health screenings with residents of the community. And some of the things that were highlighted through the social determinants of health that we completed was food insecurities, health literacy, childcare needs, and certainly housing insecurities. These are all inequities that we know existed prior to the pandemic, exacerbated during the pandemic, and as we begin to turn to some resemblance of normalcy, these inequities still exist, and we continue to provide our community health workers with trainings around these areas so we can address the needs of our community members as needed. I believe that concludes our portion of the presentation. Dr. Wardell, I will turn it back over to you.
That's great. Thank you so much to both of you, Jenna and Kenzel, for sharing those experiences and the great work that you all have done. And again, a theme here in terms of community health workers, right? And the value of community health workers, the importance of the training, the importance of being from the community, the importance of getting the certification. And so when we get to our Q&A session, I think it might be good for all of you to sort of comment a little bit more around that in terms of the financial support for those, if your state is one that provides billing, for example, for those services and how that could help with sustainability. So heads up on a question like that may be coming your way. We have a poll question, and I did also want to, let's see, was that in, and again, the Department of Health and the health equity funds through the Department of Health. And so thank you again for lifting that up as another place and space that hopefully all of our community-based organizations are reaching out and trying to make those connections with your health departments. So I believe we have a poll question, our second poll question coming up. So why don't we go ahead and pull that up? Okay. And this one, we're not going to show the results because it is a qualitative, if you will, answer, meaning you sort of just type in your response. But let me read the question for you. What other resources and or information would be helpful to your organization and community in the next 6 months to a year to fight against COVID-19? So that's the question. And so take a minute as we continue. I'm gonna leave it up here for just a minute, the question, and make sure you can read it. And then you can type your answers in. But while it may go off the screen, I'm seeing a message that someone says that they don't see it, but it is on my screen. So let me read it again, and you can go ahead and put an answer in the chat if you're not seeing it. What other resources and or information would be helpful to your organization and community in the next 6 months to a year to fight against COVID-19? Okay. So now we're going to move to our Q&A portion. And again, the question will still be there in the background that you'll be able to answer. And so we're going to get all of our speakers back on the screen. And we wanted to make sure we allow time for questions and some discussion. So I think I see everyone. Do I see everyone? Yes, I do. So let me go ahead and get us started. And Venus, I believe this first question is going to come your way. So how can you talk with the audience some about how you engage with your sponsors and secured your funding for your work? You had a number of sponsors there. Maybe if you could talk a little bit more about how you engage with them, why they wanted to work with you, what were the things that were most important to them, and if you had any tips for other organizations as they are continuing to try to secure sponsors and support for the work that they're doing. And make sure you unmute.
There you go. Thank you so much. Really, I have been really blessed. They have reached out to us because we were involved in the community. We were making a lot of noise because there were things that we were sharing with other people about the disparities and how we are looking into some of these gaps and how our community felt like it was an afterthought. And so they responded back to us. I was involved, participated in a lot of webinars. And during those webinars, we would always have somebody come back to us and wanted to know more about how we did what we did. And our training, we're offering our training programs. And if you go to our website, I think it's already up there on the slide on the chat, but we are open to helping anyone who wants to look at our website and use our training programs in their own community, because we've been blessed with, like I said, sponsorships for many topics. Our topics range from, what happened with COVID. That was something that we decided to do with some of the funds that we had just initially. We have a separate fund just for my translation work. And I felt like until we get a sponsor, we've got to get this information out. And lo and behold, after that, we were able to get more and more people. But we nurtured those relationships. It wasn't the kind of thing where, they funded us and that was it. And bye, I'll see you in the next funding cycle. Every time we were putting together a webinar, we would invite some of the folks to listen. Our events, we have our Health Fiesta, our signature Health Fiesta, and we would invite them to come if they wanted to set up a table with or without any funding. I mean, we just wanted them to know that, they're family to us. If you work with us and you care about our community, you are familia to us. And again, CDC Foundation gave us some seed money for some of our Health Fiestas this past year. And some of the others were really specific to topics. We just were funded recently by Bristol Myers Squibb for respiratory diseases, because that's what we're hearing now. With long COVID, we're getting more and more people with asthma, with, the pulmonary obstruction, cardiovascular diseases. I mean, the list can go on, and we don't know what's going on with long COVID. We're not getting the answers. So when people are calling us, they're concerned. And of course, we're trying to navigate them to the right resources.
That's great. You said you were making a lot of noise, and you were visible on webinars. And so the word visibility came to mind for me because, it's sort of like you were making some good trouble, right?
Yeah.
And that good trouble, that increased visibility, and then doing the work, right? Is important, and nurturing those relationships. And then folks want to continue to support you. And I think you're being very creative and smart in terms of reaching out to, the issue that is in front of folks right now is some of the challenges around the additional respiratory viruses. And so how do you leverage those kinds of resources and opportunities to kind of keep, your infrastructure in place? So some great tips there. Let's see. So my next question is for Khadijah. Hi there. How would you be able to get, how were you able to get your total vaccinated data for your work? The data and being able to gather that and to utilize that and leverage that is obviously important for all of you all's work. So maybe you can share a little bit more about that.
Yeah, I'm happy to share that. So actually, I was saying, one of our partnerships in this work was Practice Transformation Institute, and they are certified to do vaccinations. And so what we did is we would do a lot of pop-ups, as I was sharing, as part of our strategy at events. And we also, last year at the height of Omicron, did pop-ups largely within the schools. So we had great partnerships, I forgot to mention that earlier, with a lot of the public school districts in Metro Detroit. And I mentioned that because we had to train many people to serve as the frontline gatherers for the check-in process and the data when we do these pop-ups. And so we had very specific sheets, forms, and everything in order as required under our health department through Practice Transformation Institute, with all that data and information, what type of shot. And I mean, I'm trained on putting the numbers on the cards and doing all these things, location, lot number, and so are many others. And so we had a very strict process after we would do all of these events of collecting the information. And we actually used some of the grant funds provided through this work to have somebody whose sole job was tracking demographic data and making sure all of that was entered. As a backup, of course, the data went through MICR and did all of, all the proper processes and protocols were followed, but we had our backup spreadsheet where we were able to do quick tracking, and we even know the zip code locations and all of that type of stuff for those who were able to get vaccinated. So having resources through this grant to kind of allocate a point person to help track that data as we're going quickly through pop-ups was really key and very helpful. So I think that's something to consider also, for future endeavors and efforts.
That's great. Thank you for that. And I think it's an important issue too, in terms of organizational capacity, because no matter what you do, folks are going to need the data and the information. So how to really, sustain that and build that in is important. So, so a number of our audience members are interested in hearing about your ideas about how to increase pay for community health workers and promoters. So Kenzel and Jenna, how did you do that in your community?
So it was a couple of things. I think at the height of the pandemic, the state had allocated those additional funds for us to be able to increase the pay rate for community health workers. And we have been advocating with legislators here in Rhode Island to establish a higher pay rate for community health workers overall. Currently, the pay rate right now is $12.13 per 15-minute intervals. But when you look at the level of need in the community, certainly we believe that pay rate does not come anywhere close to the work that we are asking our community health workers to do to assist our community residents. So we continue on our end to advocate with our state legislators to push that rate up to a comparable rate where it is a livable, comparable wage for our community health workers.
Yes, thank you for that. A livable, comparable wage should be the minimum standard.
Correct.
All righty. Now, Venus, you mentioned previously, my notes are moving here. Okay, hold on. You mentioned previously that community health workers are the key to sustainability of community-driven programs. So perhaps several of you may comment on this. But have community health workers been connected with sectors such as housing, transportation, city government, for long-term employment, sort of, if you will, kind of thinking about how you can embed community health workers in all segments of a community, particularly as we think about the social determinants of health. Have you all given some thought to that or aware of how that may be working in your communities?
Absolutely. Well, our Health Fiestas is a one-stop shop. So we provide the services that they need, and that is where we're gleaning from them all the issues that are going on in their lives, their gaps, their barriers. And then our Telehealth Community Navigation Center, right after they all participate in our events, then we call them and we begin to navigate them to the proper resources. We've been really, again, blessed. And I keep saying blessed because everything we are doing lately has been a blessing. We have been blessed with really good partners in our community. So if it's somebody who's dealing with domestic violence, we already know who to immediately call. That person, we already arranged the pickup of the family, the woman and her children. We do all of that. When it has to do with transportation, we have a contact and we go right into our Uber fund and we provide the transportation in order for them to get from point A to point B. And so we're on top of, we already anticipate some of their issues and barriers, and we already have set aside these slots of funding available for our community health workers to go ahead and actually navigate them through their proper resources. And it is hard, and I was devastated to hear about the $12. I mean, we pay our community health workers that are beginning with our program $20 an hour, and that's just the beginning. It is sad that community health workers are not perceived as valuable, and they need to be integrated into public health at an equitable salary or compensation, because they're doing phenomenal work. And that is what we're seeing, is that they're doing all this good work, and we're still trying to struggle to get the funds to compensate them because we don't want to lose them. But people need their services, and that's key in order for us to eliminate some of these social determinants of health issues that we run into.
Yeah. Anyone else want to comment on that?
I completely agree about, the rates, and just making sure that moving forward that we're continuing to drive on policy to support the work. It is so key, and it is so important. You are not going to, take any large body or large organization and have the same impact as you are with people who are trusted, that have built those relationships. And I know I've mentioned build relationships probably 20 times on this webinar, but those trusted sources are going to be the key to changing health disparities and really addressing these social determinants of health. And so, we're just getting started. So to kind of circle back to your question, because we're in that training space next month, we're not, as far along. I know we'll learn some things, and we're trying to anticipate that, but we'll have our team of workers trained up, by February. So we'll continue learning and growing as well.
Okay, thank you. I'm going to switch gears here, and perhaps maybe Jenna, I'll start this question with you, and then others can certainly chime in also. But if you could send a message to the philanthropic community out there regarding the importance of funding community-driven solutions, what would you say?
That the community has the answers, and that you just have to listen. And I think that's what we've learned, as we've deployed community health workers, as we've convened residents and we've convened stakeholders, listening in using their ideas and their solutions, and before you decide where money is going to be spent and how it is going to be spent, is pivotal to good outcomes. So that would be my message.
Okay. Others? We may have philanthropic organizations on the call today. What would you say? What would you say to them?
I think one thing that I would say, and just to add to my colleague's point, I think the best way to sustain a community is to invest in it. And if you are willing to spend your dollars with folks that live in the community and give them the tools to not only support themselves, but to support others in the community, it is a win-win for everyone. So my message would be, if you are committed to supporting, communities, please support and think outside the box and invest in the residents that live there. Give them the opportunity of employment with a livable wage so they can support themselves, their families, and enlarge the community.
Yes.
And I wanted to say, we have a phrase: if the challenges are in the community, the solutions are within the community. We just seem to put together these plans of action in these cubby holes, and then they send them out for community health workers and community-based organizations to distribute and to implement them, without calling us to be there on the planning stages, so we can tell them early on, don't waste your money on a project that's not going to reach our community. These are the needs of our community. Invest in this first. And we saw that in the beginning of COVID, all of these millions of dollars going into these institutions to research us, when we already knew what the problems were. We just needed those transportation fares. We needed, be able to get these sites for testing in our communities and areas that no one wanted to go to. We knew what our community needed, but no one asked us. And that has been frustrating for many of us community-based organizations, that for years we've been discussing health disparities, for decades, and we're still running around talking about it. We need to put some of that money into community-based organizations and into faith-based faith-based organizations that are really on the ground, the foot soldiers that are really trying to work through all of these issues within our communities. We can no longer continue to fund institutions where half of the funds go into their facility and very little comes to us. I can't believe one particular institution wanted to give our promotoras $25 gift cards for 200 surveys. I mean, you know, this is just the way they have thought of community-based organizations and promotoras and community health workers as, you know, just people, volunteers. Well, no, we are really key opinion leaders, and we need to be compensated, and they need to already shave off some money from the beginning. And this is for this community-based organization, for this particular health ministry, because they're the ones that are going to bridge that gap.
Investing in the community and investing in listening and acting on what is already known. So given all of what you all have said and the partnership opportunities, the resource opportunities that are out there, like with some of the health equity resources, have any of you been successful in sort of being able to secure some of those resources to be able to do exactly what you're saying? Like, you know, don't study anymore, just, you know, invest in the solutions, work with us, partner with us, listen to us, and invest, particularly, again, with some of the resources that may be coming through health departments from an equity, you know, perspective. Can you speak to some of that may be some tips for others that might be struggling with that?
I can kind of start that off. So as I was kind of sharing with the group, you know, one of our strategies was that we built on the work using data from this, you know, current grant to then be able to be fortunate enough to be awarded that additional grant funding through Michigan Department of Health and Human Services and the Michigan Public Health Institute. The data piece was really key, right? So like making sure that there was infrastructure and mechanisms built from the beginning to track the work that was being done. And that was powerful. And it was powerful in being able to then spin that into additional funding and additional grants. And I would say that, you know, kind of as we're looking at our sustainability model through that additional grant funding, to really just tag on what Venus was saying, you know, one of the strategies used to that is the council deciding what to fund in the community with local organizations through mini grants and through all of that. And I know that it's in itself is not a new concept, but I really think she touched on something key, and that when we're talking about investing in the community and when we're talking about, you know, the community has the answers, that is true. We also have to be, funders also have to be very conscious to make it so there's not so many barriers for community members to access the funding, because that's kind of another layer that we see where it's like, yeah, we're going to invest in the community, we're going to offer this type of grant or this type of thing. But then when you're talking about, you know, a small church or a small organization, they're not going to write a grant or necessarily do things the way a large entity that's used to dealing with, you know, lots of government funding and federal funding. So being sensitive to still be able to get resources in the community in a way where there's accountability, but there's not 10 extra layers of red tape and truly accessing it. So I just wanted to elevate and raise that up, as well as when we're talking about, you know, success around building on the data.
Absolutely an important point. So I'm going to give each of you an opportunity to take about 15 seconds. And through the lens of sustainability, we have a lot of organizations that have been working hard on COVID, just like you all. Concerned about the staff as the staff transition and the staff well-being. So maybe if you could briefly speak to what are you doing to support sort of that well-being of your staff as some of them continue to work on COVID, but perhaps maybe it's not quite as intense, but there are all these other issues. And so what is that looking like for you? Or do you have any tips for your colleagues? And then just any sort of last sort of final word around sustainability, if you had a key tip that you want to leave with your colleagues across the country? What would you say?
Dr. Waddell, I can start us off if that's okay.
Yes.
I think in terms of for us here at Family Services, keeping a pulse on the staff is critical. And, we take self-care here very seriously. And we, encourage our staff to take care of themselves and to take their days off and use supervision on a weekly basis to be able to process some of the challenges that they are assisting folks within the community. So, we ensure here that we support our staff, both from a supervisory standpoint and also encourage folks to exercise self-care because they can't serve the community to the best of their ability if they are not caring for themselves, correct? So we certainly highlight that here. And I think in terms of sustainability, certainly through our lens is continuing to advocate for an increased reimbursement rate for community health workers. As I mentioned, the rate earlier certainly does not come anywhere close to the work that our community health workers do. It is a thriving profession here in Rhode Island, and we would like to see the rate match that, and we will continue to advocate. And my advice to those on this call is, if you are not satisfied with the reimbursement rate, then you certainly continue to advocate for that as well.
Great. Thank you, Kenzo. That was great. Okay.
And then, so I wanted to share, thank you because that's true. So through Kenzo, thank you for bringing that up. Texas has a certification program where every 2 years, the community health worker must have 20 hours of what they call CEU, continuing education. So keeping up with their knowledge, with the up-to-date information. There's some places that just train community health workers a one-time deal and that's it. But we have to constantly celebrate them, give them the tools that they need, invest in them in such a way where they are also part of our family. So if they're having any issues, if they need any help with any kind of navigation, whether it's for a breast exam or any other thing that has to deal with chronic diseases, we're there for them. So we have developed this familia concept and our promotoras. And I want to share one of the community organizations that we admire a lot is Visión y Compromiso in California. They are one of our partners, and both Visión y Compromiso and Día de la Mujer Latina are constantly trying to get the funds in order for us to compensate our community health workers and our promotoras. And it has been difficult, but we are constantly celebrating them. And when you feel that somebody cares about you and your family, then you're loyal to that organization. And that's what we have. We have a great loyalty plan.
That's great. Celebration is important and self-care is important. We've got about 2 more minutes before we need to wrap. So I'm going to turn to Jenna to see if you have a word or two you'd like to share.
So I absolutely echo what Kenzel said on reimbursement rates. But the other thing I just want to acknowledge is that for community health workers, certainly as all of us and all of, community health workers are no exception, have gone through their own personal journeys through the pandemic and have changed in that way. I think it's important for us to acknowledge that the role of the community health worker does look much different now than when it did at the beginning of the pandemic and before that. We have asked community health workers to step up, to be the frontline defense, and they've been asked for more and more and more and more. And so I think it's time we need to sort of sit back and see what has fallen with them and listen to them about where that role needs to go within the community, because there's a point where you can't just keep adding and expect it all to be carried forward. So
that is so true. Dr. Watkins, I'm going to turn to you in just a second to see if you have a final word of wisdom you'd like to share. But Khadijah?
Yeah, sure. Just real quickly, once again, agree with everything everybody's saying. I think it's going to be very important to continue to advocate. So all of us can take an active part in that. We will be taking an active part in advocating for rates and all of the policy changes that need to be made. And that's something that's continuous and ongoing, but certainly making sure that continuing education is provided for the workers, because nobody's going to take that education and that expertise away. And the more knowledge we can give, it's going to continue to set people up in positions to continue to grow and be able to do more and give them the choice and option in their community of what direction they want to go into. So, so thank you.
Yes. Policy, partnerships, people with passion, and Dr. Watkins, you got a P to add to that?
Perseverance.
Perseverance, there you go.
Hang in there. We're talking about sustainability, and I need for all of you to recognize who you are within the system. You know, COVID-19 gave us a view of what the importance of community-based organizations. And you were invited to the table, but for the first time, they didn't have the answers and you do.
Mhm.
And so that makes it even more important. And as Venus said, Dr. Waddell has said, you all need to continue to make good trouble, get into good trouble, because it is you who makes the difference in the community. The health department, other health entities can't do what they do without you. So recognize your importance and continue to persevere. And lastly, get a sustainability plan.
All righty, you heard it there from our expert, Dr. Marilyn Watkins. So again, thank you to all of our speakers for your expertise, for the work that you're doing, for everyone on this call and those who are not on the call today, for all of your contributions. We're going to have a final poll to come up in just a minute, but before we do, and as we close out this webinar, I did want to provide you with an update on several components of our capacity building efforts that we've been doing with you. You know, for the past several years during the height of the pandemic, the foundation has worked closely with many of you on COVID-19 capacity building efforts as part of a project funded by CDC. This particular project and that funding is coming to an end. But I'm really pleased to share that several of the key elements of this capacity building assistance work will continue in the foundation. Our monthly newsletter, for example, which you all indicated through the poll was an important resource for you, has featured a wide range of COVID-19 related materials and information, ranging from graphics to guidance links. And we're going to continue that, maybe not as frequently on a monthly basis, but perhaps maybe 6 times per year. We also are going to continue our webinar series and currently working on plans for 2023. I can't thank Health Leads and Vaccine Equity Cooperative enough for the partnership and the collaboration. They have truly, truly been fantastic. So we're going to probably be doing these quarterly as we move forward. So we hope that you will continue to stay on the lookout for the presentations when they are available. Our next newsletter will be in December. We're going to continue with our resources page. So continue to go to the CDC website and look for those resources. So I'm going to close with this thought. The work you do in and for your communities is critical to the health, the safety, and the security of individuals, communities, and all those that you serve, and for our entire nation. And it has truly been an incredible honor to work with all of you over the past several years. And our team looks forward to continuing the great work with all of you as we move forward. Again, thank you today for all that you all have done, and keep up the great work and to persevere and have a plan. Thank you so much. Have a blessed day.